Good afternoon, everyone, and welcome to this year's Mesothelioma Network Education Day. It's a real pleasure to introduce you to the programme and then to chair this first session. So if I could, there we go. So we've got our first slide. So this is our programme for today. We have 3 sessions, which I think is going to be really interesting and hopefully quite a diverse range of topics. So we're going to have our first session is focused really on really an update from the network and an update on treatment. And so you're going to have to listen to me for the first 15 minutes, but then we'll move on to Matthew Tate, who's going to summarise outcomes from some of our audit data. And then from Melanie McKean, who is an expert in mesothelioma immunotherapy and trials, and will give us her perspective on those topics. We'll then have a short break of 15 minutes or so, and you'll be able to watch our GEMS animation. And then we'll have a second session, which will be focused really on the patient perspective and on some legal issues. It's a pleasure to have Fraser Simpson joining us from Digby Brown to give really a guide to the kind of legal issues for clinicians. And then we'll have Matthew Johnson joining us from Sheffield to summarise the experience of long-term survivors. And then really importantly, I think we'll have one of our own patients' perspectives with an interview between Graham Mingus and Phil Reid, who's our lead clinician in Edinburgh. And it's obviously patients remain at the heart of the network, and looking forward to hearing from Graham. Our final session will be what I hope will be an exciting research showcase, where we'll hear from Daniel Murphy, who's one of my colleagues in the Beatson Institute in Glasgow, looking at preclinical models, and then Anna Beebe in Bristol talking about the Assess Meso study. And all of the talks will be available on our website. And so if you miss a session or you miss a talk, you will be able to download that and watch it later. So just to segue into the first talk, so I'm kind of chairing myself here, but what I'm going to try and do over the next 10 minutes is just give you a bit of an overview of what we've been up to in the last year, and maybe some reflections as we look towards the future. The plan really is to try and cover these big key areas that we've been focused on behind the scenes, try and give you an update on where the network is in terms of its life cycle and our plans for sustainability. We'll touch on the NDT and the QPIs, although Matt will talk to us much more about QPIs in detail. We'll touch upon clinical management and where we are in terms of a new algorithm. And I'll also mention the other really important elements that I think add value to the network in terms of website and support groups and events for our patients and carers. So the life cycle of the network has been really a 10-year effort to this stage, and we've gone from really having no services for mesothelioma in Scotland at the start of this journey to having a regional service in the west and 1 nurse, to now having 7 nurses and leads in our major cities, and a weekly NDT and national QPI clinical standards. And all of that really has been a reflection of team working between patients and clinicians and charity partners. And it's just an opportunity here just to thank those partners, and also to thank Digby Brown, who are sponsoring today's meeting. And so we hope to be able to announce some progress beyond the life of the initial pump priming period. So our 3 years of pump priming ends in April next year. And we've had some really positive discussions with Scottish Government about embedding the network in the NHS in Scotland. And we hope those will bear fruit very soon. The network, as many of you know, is arranged as a kind of hub and spoke model, and we are now fully staffed, where we have leads and nurses, as I've mentioned, in our major cities. And we have the national hub, if you like, in the NDT in Glasgow. But really, we're a virtual network, and so we do so much by Teams and Zoom now that we function really well, I think. We were provided with 1.2 million over our first 3 years from our partners that you see there, and we're very grateful to them all. The NDT meets, as you guys know, every Friday, and if you haven't joined the NDT, you're always welcome to join to present your patient, or even just to dial in and hear the discussions and maybe learn or provide your own input. The MDT is currently going through its peer review process, and so this is the MDT Fit process that will involve, for all of our MDTs in Scotland, self-assessment, some independent peer review, and then some feedback. And so we have our MDT Fit observed meeting is actually happening tomorrow. So it'll be interesting to get our feedback and to quality assure what we're doing through that process. QPIs really were a very important focus of much of our strategy over the last 10 years, because it gives us teeth to actually mandate certain standards of care in mesothelioma across Scotland's health boards. And you can't read it there, but there are 8 QPIs, which are quality performance indicators, and these cover really all the key elements of the mesothelioma diagnostic and treatment pathway. And importantly, we have a QPI very explicitly there for access to clinical trials, and in an illness like mesothelioma, where outcomes are not what we want them to be, I think it's really, really important that we are continually driving that access to clinical trials for patients. The QPI process has now gone through its first cycle, if you like. We've had our first 6 months of data. We got a look at here in a report at the end of last year, but we've actually got our first formal review of a year of mature data coming up next month. And so all of the lead clinicians in the different health boards have been asked to look at their own performance against different scores, and also to give us feedback on maybe reasons why they haven't been able to meet targets. And it's by analysing that variance in outcomes and performance that we can actually raise standards, and we can help individual boards maybe get up to better performance. And it also gives us a chance to review the metrics, actually look at the things that we're measuring, and just be, asking the question about, are those actually still useful? We also have been very active in aligning a larger data set of fields for 2 projects. One is making sure that we have a patient level data set that's completely aligned with the UK data set, so that we can contribute Scottish data at a patient level for the first time to the national UK-wide meso audit. And so that is, as some of you know, is going through a bit of a change as we move away from RCP management. And so there's a tender process out now through Meso UK, and we will be able to contribute Scottish data into that national report for the first time. And so that gives us really an important opportunity to benchmark and compare where we are with our peers. On the right there, you see the staging card that many of us use, or we all use, to make sure that we're characterising the extent of disease properly when we see patients in the clinic and we discuss them in the MDT. And the basis of that staging system is data collection and outcome comparison that's done globally, done by the IASLC. And Scotland has never contributed data to that before. But we have put ourselves now in a position where we've got all the approvals coming through the pipeline, so that we're going to be able to submit national Scottish staging data by the end of this year into the ISLC Meso staging dataset, and that means that Scottish patients will be contributing to the next staging iteration of the TNM algorithm. Clinical management, as you can see from this slide, and you're not meant to read the detail, but it is becoming more complex, and that complexity is a good thing because it reflects an expanding evidence base and some more options. As some of you know, and we'll hear more from Melanie, we have seen positive results from combination immunotherapy in the first line for patients who have disease that's not technically resectable. And so we are currently going through a process with the Scottish Medicines Consortium, which is NICE's equivalent in Scotland, to try and push for that treatment to be funded and be made available for Scottish patients. And so many of us have been involved in putting in submissions to support that application. And some of us were involved in a PACE meeting, which has involved patients and clinicians to make that case to the Scottish Medicines Consortium, and that decision is pending at the moment. And at the moment, patients they can get access, but it requires an individual application through their oncologist, which we hope will change. And we're in a challenging time around how we discuss and how we advocate and how we refer patients for radical surgery in mesothelioma. Many of you know that the MARS-2 trial finished recruitment fairly recently and won't read out its results until 2023. And there's been a long legacy of offering radical treatment to patients who are very fit and have early stage disease. But at the moment, we don't have any robust evidence as to whether it extends life. We also don't have any robust evidence as to whether it does harm. And so we remain the equipoise that remained at the start of MARS-2 is still here. So what we're trying to do through the NDT is to manage that discussion for patients so that they're not disadvantaged, and they may, if it's appropriate, in selected cases, they get the opportunity to discuss all the uncertainties around surgery with a surgeon and with their oncologist, and to make an individual decision. And also we provide a number of other really important functions through the network, one of which is the website that provides a resource for professionals and patients, and also some guidance on symptoms and what different treatments mean, and gives you access to your nurse specialist directly. And we also have a Twitter feed that you see there, which is @ScotMesoNet, where we try and provide some useful updates. We're very proud to still provide virtual support groups, which run once a month, with great help from Maggie's in Inverness. And we'll continue to do that and provide a forum for patients and families to connect. And earlier this year, we ran our first patient and carer virtual event. So it was an event just like this, but we tailored the programme really to the needs of patients. And we had a variety of topics covering compensation and trials and symptoms. And we had some breakout sessions on mindfulness and some other things. So we'll continue to try and do those things. And also, you're going to hear from some of my colleagues who are involved in Predict Meso. So Predict Meso is an international research collaboration, which I have the pleasure of leading. And it's CRUK awarded us £5 million to try and develop some new therapies that would be ready for studies in patients. And you're going to hear from two of the investigators there. You're going to hear from Daniel Murphy, who's primarily involved in work package 3 and 4 and mouse and animal models of mesothelioma. And you're going to hear from Anna Beebe in Bristol, who's involved in work package 5 with Assess Meso. And finally, just my last slide is just, I think you'll see it on some of the slides that run through in the background, is that is, we're really proud to have been nominated at the Scottish Health Awards, which is happening next week in Edinburgh in the innovation category. So the Meso Network has been nominated there. And so there's a fancy black tie dinner in Edinburgh that we're hoping two of the team members will go along to. And just the nomination, I think, is great credit to everybody in the team. Whether we win or not is always a bit of a lottery. So that's really all I was going to say. I think I'm kind of just at my 15 minutes. What I'd like to do now is just, before I introduce Matthew Tate, is just we want you to be involved. We want you to ask questions. There will be a Q&A session at the end of every talk. At the end of every session. Now, to use that, you need to use the Q&A session on Zoom. So it's not the chat function in Zoom that you might be used to using. So if you select the Q&A element of the screen and then just post your questions, and then I'll read them out, and we'll have a Q&A that involves myself, Melanie, and Matthew. So please do put some in, because otherwise it'll just be the three of us talking to ourselves. So I'm going to move on in the programme now and introduce you to Dr. Matthew Tate. So Matt is a clinical research fellow who works with ourselves in Glasgow. He's been with us for about a year now, and he is part funded by Macmillan to try and bring together the national network clinical data and the outcomes to try and help us understand the impact the network's having, and how we might learn from those data to improve services. So I'll hand you over to Matt, and please do post some questions in the Q&A.